Welcome to the ICU and CCU status board overview. This video will walk you through the various columns on your ICU and CCU status board. To begin, when you sign into Sunrise Clinical Manager, you would be used to seeing a view that has your patient list populated. We are going to be asking you to switch over to status board. And you can do that two ways. You have a status board button located here, or if you go to the bottom left-hand corner, there's a button called Sidebar, and at which point you can use this button here called Emergency Care, and that will take you to your status board. When I click on Status Board, you then have access to the various columns on your status board. Your status board is a communication tool that shows the up-to-date status on your patients. Information in the different columns are populated either through registration services, through some ancillary departments such as lab and medical imaging, and there will also be updates required by different roles in your department. To begin, your department is defaulted to your unit. You also have different views. It will always default to an all beds view. When you use the drop-down arrow, you're able to go to different views depending upon the unit that you are working in. Location column, that is auto-populated from registration services when your patient is admitted. This will show the location of your patient. The status column, STS, is either the status of your bed or the status of your patient. Status of your patient, when you select a line and you double click, it opens up a drop-down list which you're able to choose from. These are the different statuses for your bed. It will then be color coordinated according to the different statuses. So we have dirty, out of service, reserved, terminal clean, or occupied. The status for your patient is as well a drop-down list. You double click and it opens up admitted, which will default when the person is registered, pending transfer if you have a patient transferring to another unit, pending discharge, and finally discharged. When you have a patient that is being discharged, you would have that status selected. It opens up another window. This is asking you if you're removing that person from that status board, and you would select yes. This automatically makes your bed dirty. When you have transfers as well will have your bed turn dirty. If you have removed a patient from the board in error, you would go to View, open up your list of options, go to Inactive Patients. Your patient will be listed here. You would select them, right-click, and return the patient. It will default to the room that you originally had the patient in. I'm going to go back to all beds. Your patient column will show the patient's name, first and last. There will be color coding according to gender, blue for boy, pink for girl. But you also notice different icons in the patient column. The bacteria icon is reflective of what you have entered in for isolation alert. The two-person icon is reflected on the fact that you have indicated that there is two patients in your department with a similar last name. You have that icon displaying when I go over to the right-hand side and I go to the name alert column and I select. Also in the patient column, you will also find a yellow triangle, which will indicate the person is over 70 years of age. Or you may also see black sunglasses, and you will not have a patient's name listed. Once you select the line, it will then show that patient's name in the patient header. Age automatically comes from registration services as well. Diagnosis. Diagnosis is a free text column. So in your columns, you will either have items populating, you have a drop down, or you have a free text. So when you free text in, then you're able to see the diagnosis. And this would be the diagnosis upon admission, but you can always update that depending upon bed rounds and what has changed with regards to that person's pertinent diagnosis. COVID screening is a drop-down. Depending upon the screening tool used and the outcome, you can select different options. Criteria unmet, criteria met not swabbed. You will notice that the yellow flashing is indicating that you still need to collect a swab. Criteria met and swabbed is yellow, and swab negative. Swab positive is red. Isolation alert as well is a drop-down list of all the different options for isolation precautions. What you select will also be indicative of the color coding for the health authority. The next 4 columns are pertinent only to ICU. This column here, IABP, is a yes/no. ECMO, yes/no. Ventilation is a free text. Oxygen treatment as well is a free text. Targeted date of transfer, when you have heard in bed rounds that that person will be potentially transferring up to an inpatient unit, when you click in this cell, you can then open up a calendar for which you can then select the potential date of transfer. Bed called for assigned. When you have a patient that is being transferred up to the inpatient unit, a call is made to system flow to have that person transferred. When the bed has been assigned by system flow, that room number will be displayed, and it will also be color-coded according to the status of that bed. If it is green, it means that it is ready. Gray, that bed is occupied. Brown means it's dirty, and yellow will mean that it's being cleaned. Nurse column is a free text, entering the nurse's name looking after that patient. Physician column, that is populated by registration services of the most responsible physician. Consult service as well is a free text where you're able to enter in the medical specialty that has been consulted for that patient. And you can as well enter in more than one consult service. When they have come and done the consultation with that patient, you can then remove it. Removing it, going into the free text column, highlighting and deleting. Your new result column, that will give you a flag, whether it will be red, yellow, or green, for which you can double click on that flag and it will show you the results. So those results will be here, or you can still go to one of the tabs called results to look at that information. Getting back to our list of columns, these 2 columns here, order status for lab and radiology, these are pertinent only to RUH. This is information that is flowing in from the order entry that's performed by staff. So when you've placed orders for lab, it will indicate pending collection. If it's for radiology, it will indicate ordered. If you've ordered up more than 1, then you would also have a ratio. This ratio indicates 0 results, 3 lab tests ordered. Temporary location is a drop-down. This is a temporary location of your patient. So this is going to be for the longer periods of time that your patient is off the unit. You want to indicate where that patient is. And lastly, we have name alert. When you've selected that, I'm going to go over to my patient column. It will indicate the icon for duplicate name alert. Each clinical unit will have a work standard outlining whose role it will be for entering in data in these columns. Please remember, some of the columns are already auto-populated for you so that you do not have to complete that task. That completes our status board overview.